We frequently get DEXA scans on our patients primarily to look for something called visceral fat. Visceral fat is fat that exists in and around the organs deep in your abdomen and even up into your chest. You can't grab it the way you can grab the fat beneath your skin. And it turns out that visceral fat is dangerous. It puts you at risk for type 2 diabetes, Alzheimer's disease, and an early death from heart attack or stroke. So it's important that we identify visceral fat. And that's one of the main reasons we get DEXA scans. Now, when I have a patient who has visceral fat or fatty liver or prediabetes, we put them on a special dietary regimen. And the shorthand for that is something called the Green Med diet. What is the Green Med diet? Well, many of you have heard about the Mediterranean diet, which involves very little red meat and dairy and more fish, dark green vegetables, legumes, nuts, oil, olive oil, that kind of stuff. And it's very heart healthy and reduces visceral fat. However, when you add to the Mediterranean diet green tea, at least 5 cups a day, and a powder from a particular kind of algae called duckweed or Wolfia globosa, the effect on reducing visceral fat is even better. So when I say that someone should be on the Green Med diet to reduce their visceral fat, that is quite simply the most successful diet to do so.